The only physician in her village, Mzevinar Bolkvadze, sees patients like this cranky baby all day in a newly built and equipped ambulatory. In the evening, she makes house calls on foot, despite a bad leg, clocking over 10 kilometers up and down mountains. She checks on an 85-year-old patient she persuaded not to give up on life. Doctor to 1,600 people, she needs a smattering of training in geriatrics and more. She took a 6-month family medicine course to better serve her many kinds of patients. And she just completed a short-term course in emergency medicine.
I
did the emergency training a week and a half ago, and I already have had a case where I badly needed it.
It's summer now, and she could have called an ambulance. But in winter, this high mountainous region is cut off from the rest of the world for up to 6 months, and Dr. Bolkvadze, like many other village doctors, relies only on herself and her training. The emergency medicine course taught at this family medicine training center in western Georgia is one of the first in the country. It's part of an overhaul of primary care that includes intensive retraining of physicians and nurses supported by the World Bank. Courses of all kinds have been designed. These nurses are learning hands-on how to care for patients at home. As part of the reform, instructors were trained, buildings renovated and equipped. Training centers outside the capital make it easier for doctors in remote or rural areas to attend.
I think this is very interesting for this, to improve their skills, their knowledge and their attitude.
Better doctors and nurses with new equipment will provide better health care to patients. This clinic was renovated with state and local funds. Equipment and retraining was provided by the World Bank. Its 3 doctors are taking the emergency training in stages. Dr. Jikhashvili took it first.
I learned better skills and up-to-date information.
Her colleague hopes retraining will make her more independent.
I had cases where a patient died, and I had trouble telling the relatives, and I let emergency workers do it.
When asked what other training she would like, she says cardiac care. Up in the mountains, Dr. Bolkvadze agrees. She said cardiology training is crucial.
It's very important for us to have training. Even if it were every month, I would move heaven and earth to get there.
She hates to be away from her patients, who are free to call her day and night, but says retraining has made her feel like a new doctor.